Deidre, thanks for joining us. I just wanted to catch up with you because there's been a lot of announcements, and I still think a fair amount of confusion with regard to a lot of people saying what happened. The system that we were told up until a couple days ago we were probably getting based on recommendations of the CDC has now changed to an age-based system. So what do you say to some of those essential workers and those people with comorbidities who really feel like they should be next and thought that they were next?
So thanks for the opportunity, Matt, to talk a little bit more about this strategy. What occurred is that as we looked at the list that the CDC had given us, both for chronic conditions and for so-called frontline essential workers, and I don't mean so-called in that they're not in the front line, but that's the term that had been coined by the CDC. What we found was that defining those people would lead us to have a very, very large next phase of our vaccine rollout. And as you know, Matt, we're only getting in the state now just around 90,000 first doses per week. So we don't have enough vaccine to vaccinate everyone who wants to be vaccinated right now. That's the bottom line. So as we looked at the next group of frontline essential workers and chronic conditions, we certainly understand and appreciate that people are disappointed that they need to wait a few weeks longer. But the group was going to be so large, we were going to need to stratify them in any case. Otherwise, we would have had 1.5 million people calling for an appointment next Monday. So we would need to stratify by age in any case. And so we didn't want to have a more complicated system and add age. So just going with age alone was the simplest and quickest way to get everybody vaccinated.
So what is it about an age-based system that you believe is the correct approach to take? I believe there's only one other state, if I'm not mistaken, that's doing this, and that's Rhode Island. So what is it that makes an age-based system so effective?
Well, great question. So first of all, 98% of our deaths in Connecticut from COVID have been in people over the age of 50. So targeting people who are older will help us prevent death and severe disease. And that's been the target of the governor's strategy from the beginning. The other principle that the governor is focused on is equity. And we know that the more complex a system is, the more it favors people who have time and resources to work through that system. So a simple system that says, I know how old I am and I know when I will become eligible, favors equity. And let me say one other thing that was a very critical part of the governor's announcement this week. We are setting targets for ourselves and for our vaccine providers to make sure that people who live in the highest risk communities are receiving vaccinations in proportion to their population. So we're going to be measuring, we've been, as you know, Matt, reporting vaccinations by race and ethnicity and vaccination by high-risk town versus lower-risk towns. Now we're going to start reporting of the people that live in those communities, what percentage are getting their vaccine. And that's going to help us address the equity concerns as well.
You said that this age-based system lends itself to equity. I've heard from several people the exact opposite, that this is too simple, it lacks nuance, and that a lot of the people with comorbidities disproportionately are in minority populations. So how does an age-based system really lend itself towards equity?
Well, understood. And it's because most of the deaths of all races and ethnicities have been in people over the age of 50. 98% have been in people over the age of 50. So a complex system disfavors, and we've seen this to date. We've heard so much from the community that understanding if you're eligible, needing to work through a more complicated appointment system, needing to understand where to go to get vaccinated, all of those elements of complexity lead to a worse problem with equity. So by making it very clear who is eligible and on what date, we can communicate clearly. And then the companion piece, Matt, has to be setting those targets so so that we're looking every single week, are the people who live in those highest risk communities actually getting the vaccine?
You mentioned those targets. What if one of those targets that's set for a provider is not met?
Well, we've been talking to our providers about how to implement this strategy. The first thing we have to do is measure and show it to the providers. Here's how you're doing. And then we're going to be bringing them together on a regular basis. As I said, we've started that already, so that they can share their best practices with each other. This is going to take a lot of work. It's not just a matter of setting up a mass vaccination site in a parking lot, which is important, but this process of reaching our highest risk communities is going to require outreach. It's going to require engagement with community organizations like faith-based organizations, senior centers, senior high-rise, anti-poverty organizations, advocacy organizations for people in minority communities. And our vaccination partners are eager and ready to continue, and many of them have been doing this work right from the start, but they're eager to work with one another, share their best practices, and get out into these communities and make sure that they're reaching the people that need to be reached.
But just to be clear, is there going to be a penalty for a provider that doesn't meet a target, or will they be actually given extra resources and help?
Well, definitely the latter, because we want to make sure that, first of all, people know whether they're reaching their target, and then we want to hear back from them. How are you addressing that? Here's how we did last week as a state. How are we addressing that? We haven't talked about other kinds of penalties yet, Matt, and we're not at that point yet. But the first step is accountability for the state and for the providers.
Dr. Gifford, what happens to the 30-year-old young, healthy healthcare worker who perhaps decided to wait a little longer to get the vaccine? Now they're ready to do it. They are part of phase 1A and are eligible, but now there's this age-based system. There's this carve out for the dedicated teacher clinics. So are they still going to be at the front of the line, or are they now going to be lumped into this greater pool?
Everyone who was eligible, excuse me, from the beginning continues to be eligible. So they will need to call or use the online system to get an appointment like everyone else. But they certainly remain eligible. And in addition to that, individuals that live in congregate settings, group homes, shelters, those types of settings which have been eligible will continue to be eligible. And we're working hard to get out to those sites to make sure that we're vaccinating residents and staff at those congregate settings as well.
I want to talk a little bit about these teacher clinics. What specifically are they going to look like? Are they going to be going within the schools into gymnasiums or maybe parking lots? Are you going to utilize school nurses to vaccinate? What is that effort going to look like?
It's going to vary from district to district. And the work that's happening now as we speak is that superintendents and districts and local health departments and other vaccine providers are working together to set up their local strategies. So in some cases, there may be a vaccine provider that goes out to the school. There may be a clinic that's set up in another location, or some combination of those two things. And I want to remind everyone that professional childcare providers are also part of this. And so we are working, and our great Commissioner of Early Education, Beth Bai, is working with her licensed providers to make sure that they are also finding vaccination partners and hooking them up with the schools so that they can work together to make sure that their staff also gets vaccinated.
The vaccination timeline that the state has laid out, is that based on a projected allocation of doses from Moderna and Pfizer, not including Johnson & Johnson? So in other words, if we do get the Johnson & Johnson FDA approval and that gets rolled out, could we accelerate this timeline?
We could, but we have a very modest estimate of Johnson & Johnson in our current projections. And because we don't know how much we're going to get, we know there will be some. So if we get more than that modest projection, we might be able to accelerate the timeline, absolutely.
What is it about the Johnson & Johnson vaccine that has people so excited?
Well, it's one dose primarily, which is a big advantage for certain populations in particular. It's very effective, 85% effective against severe disease. And there were no deaths in the arm of the trial that people that received vaccine. So it's a highly effective vaccine. Its storage and handling requirements are simpler than the Moderna and Pfizer vaccine. So it's a little bit more nimble in terms of being able to deploy it out in the community. So for all those reasons, and just because it's going to enhance our supply at a time when, as we've been talking about, demand is very high, there's a lot of anticipation about what the FDA and the CDC are going to say this weekend.
And while I have you, I guess the last question would be, we've been seeing some very positive trends when it comes to the COVID statistics, the infection rate continuing to drop. The X factor in all of this would seem to be the variants, which we know exist here in Connecticut. How concerned are you that those variants could lead to, I guess we would call it a third wave?
Well, Matt, unfortunately, we're still not out of the woods there. And with all of the talk and excitement, understandable around getting our population vaccinated, we still have several more months to go of the mask wearing and the physical distancing. We will start to see light at the end of the tunnel, we hope, here in the coming months. But as you point out, there's still a chance that we could see a resurgence of these variants. And so we're reminding people whenever we can to keep that mask on, keep the social gatherings small and outdoors whenever possible, and work from home if you can. All the things that people in Connecticut have been doing so successfully for the past 10 months, we need to keep up for a little while longer.
Dr. Deidre Gifford, Interim Commissioner of the Department of Public Health, really appreciate your time. Thanks for being with us.
Thank you for having me.